Hello, everybody. My name is Grace Noonan. I am a second-year medical student at the University of Kansas School of Medicine. I'm so excited to be here today. Thank you for allowing me to present. I will be presenting on our project titled Pandemics Interlaced, the impact of the COVID-19 pandemic on the well-being of sober living home residents. And I'd like to thank Dr. Jason Glenn, who was my mentor for this project. He was so helpful. Couldn't do this without him. So for an outline for this presentation, we'll first look at the background and the importance of this study. We will talk about the social model of recovery, which we've already touched on a little bit, and then we'll talk about how the COVID-19 pandemic can impose different risks on these sober living home residents. We will then look into the study aims and objectives, followed by the methods, then results and conclusions and future directions. So for the background, you might be asking yourself, what are sober living homes? Well, sober living homes are drug and alcohol-free facilities for individuals recovering from substance use disorder. They have been shown to produce higher long-term sobriety maintenance through a social model of recovery, which again, we will touch on. They've been shown to lead to less arrest, decreased psychiatric symptoms such as anxiety and depression, which are common with substance use disorder recovery, and they've also been shown to increase employment. So moving on to the social model of recovery, this is, I'm sure you all are all aware of it, but it is a tool used in SUD treatment that utilizes peer support to aid in recovery. There are some key components to it, such as the 12-step program or other mutual help strategies, which I'm sure you are all familiar with. And it really emphasizes the involvement of participants in decision-making and governing of the environment to create a recovery-friendly experience. And it also emphasizes recovery as an interaction between the individual and their environment. So some key themes that we can draw from the social model of recovery is utilizing the support of others and increasing the social identity and interconnectedness. So now we can look at how the pandemic can impact sober living home residents. So it has been shown, well, first of all, we know that COVID-19 really emphasized social distancing, which was absolutely necessary to decrease viral transmissions, as we know. However, this social distancing and social isolation can impact factors that are integral to the social model of recovery. And then therefore, this can increase the risk of relapse. And some themes that we'll be touching on today are interconnectedness and the use of social support services. Additionally, it has been shown that many residents have non-essential employment that could have rendered them unemployed during the pandemic. This can then lead to financial stress and difficulty paying monthly rent and fees, which then increases their risks of being excused from the home, leading them to be homeless and increasing the risk of relapse in that setting. So therefore, now that we have all of that kind of in our heads, we can figure out what our study objective was for this project. So the aim of the study was to discover how the course of COVID impacted the well-being of sober living home residents. And we defined well-being through several different mechanisms. We wanted to first look at the psychiatric impact of, or the psychiatric component of the well-being, and then their risk of relapse from a response from that. So we looked at social services used within the home as kind of a measure of the social model of recovery use. And then we looked at interconnectedness between residents to measure social connectivity. And then we looked at the rate and the intensity of relapse thoughts throughout the pandemic as a measure of relapse risk predictions. For our methods, we used a retrospective surveyed data from February 2020 to June 2021 from 105 individuals living in these sober living environments from Kansas City and St. Louis. Voluntary interviews were conducted to gain a better understanding of the residents' experiences throughout the pandemic as well. And then individuals were included if they had been living in the environment since February and excluded if they had entered the environment after February. Logistical regression analysis was utilized for the data as well. So next we'll dive into the variables a little bit more because there's a lot of them and they are kind of complex. So we wanted to look at the social model of recovery and social support throughout COVID. And how we did this was we asked individuals to report the number of services they used and the frequency of that service use. And when I say services, I mean house meetings, group sessions, educational services, individual therapies, and so on that are frequently provided by these sober living homes. And then we ask them to report the frequency of that service use. So all the way from monthly up to multiple times a day. And we did this in our survey at 3 different points in time. February 2020, which was deemed the beginning or deemed before the pandemic, when things were considered normal. And then in December 2020, which was when restrictions in these areas were most strict. And then June 2021, which I'm not going to call the end of the pandemic, but it was when restrictions were way more relaxed than in December. And then here I've inserted a snippet from our survey. You can see that we're asking individuals about their service use before the pandemic. Then we wanted to look at interconnectedness and social connectivity. So to do this, we asked individuals to report on the number of people they felt connected to at that time, and then the frequency of communication with these individuals, because it's not only the number of people that you feel connected to, but it's also how often you're talking to them, how frequently are you interacting with these significant people in your life. And so here is another snippet from our survey asking people those questions. And again, we did this at 3 different points, February, December, and June, just like we did with the social service use. And then lastly, we wanted to look at the risk of relapse. So we measured the frequency of relapse thoughts and then the intensity of those thoughts. So here again is a part from our survey. So you can see that we asked people how frequently they were thinking about relapsing, ranging from never to multiple times a day. And then the intensity of those thoughts ranged from 0, which was the least intense, not considering relapsing at all the way to 4, which was the most intense, and they were strongly considering relapsing at that point in time. And then again, we did this for the 3 different points. So then moving into our results, we can look at our baseline characteristics. The majority of our patients were Caucasian males between the ages of 30 and 39, which is actually an accurate representation of the national sober living home environment. The majority of these individuals are Caucasian males that are usually younger than 40 and older than 30. So now we can get into our individual variables. So looking at these social support services, you can see that there is a decline in service use from February to December, which is right when the pandemic was kind of taking its grasp on the world. And then it increased in service use from December to June. The number of services used increased, as did the frequency, but the frequency did not have that dramatic of a change, as you can see from our graphs. And then for each variable, I wanted to pull some quotes from our interviews with these residents that kind of back up our data. And so this quote was really inspiring to me. He said, "What really changed the most was that people couldn't go over to the big meetings at the main intake house. It's pretty cool as a newbie to see all the older guys come in. It was evidence that these houses work and the program works. But when COVID started, the brotherhood went down. We try to stick together as a whole, and when you can't go to the hub, it's a mess." So this is just showing that they couldn't have these big group meetings that they really relied on. And this individual went on to explain that not having these big meetings caused a lot of individuals to leave the houses, especially if they were new to the house in the first place. So now we can go on to our interconnectedness and our social connectivity. So we can see here, similar to the service use, there is a decrease in interconnectedness from February to December. And then there is an increase after that time period. You can see here on the graphs that they look pretty similar to what we were just looking at as well. So there is a positive correlation between social service use, such as meetings and therapy, with interconnectedness. And then for a quote I wanted to connect here is, "It, as in COVID, really affected people mentally because we're social people. And when we're not around people, that was the hardest for me because we celebrate recovery. And when you don't have that, I mean, like, there's no question that people struggled with relapsing." So I just wanted to emphasize here that when they interact with these people, they are celebrating recovery and they are lifting each other up and saying, we can be clean together. And when you don't have that, this gentleman went on to say that it's really easy to get stuck in your head about relapsing and what your quote unquote old life used to be like. So now we can get into our relapse predictors, which is most interesting to me, I think. And you can see that from February to December, there's a sharp increase in relapse predictors. So you had an increase in both the rate of thoughts of relapse and the intensity of those thoughts. However, when things started to open back up and people could start gathering in large groups again from December to June, you saw the relapse predictors decrease. And so a quote to support this is, "The cycle of relapsing is what I call the revolving door. You're in and out, and it got way worse during COVID." And then he went on to say, "When you're locked in and you can't go to meetings, you're losing your job. I mean, the stress level just skyrockets, and a lot of people can't take it. I mean, a couple of them, as in overdoses or suicide." And this individual had a lot to say about how not only were people relapsing during COVID, but they were actually overdosing. And he had a lot to say about how many different factors went into that, but a lot of it was stress-induced overdoses. And he was really helpful in gaining a broader understanding that wasn't just looking at numbers. So now we can take these variables and superimpose them onto each other. So this is looking at the correlation between service use and relapse risk. So our service use is here in blue and orange, or blue and gray, and then the relapse risk is in orange. So again, you can see that nice negative correlation that as the service use decreased, the risk of relapse increased, and then vice versa, moving into June. And then we can do the same for the interconnectedness aspect with the relapse risk. Again, there's a nice negative correlation that as the interconnectedness decreased, the increase of relapse, or the risk of relapse increased, and then vice versa for when we moved closer to June as well. So we can kind of go back and forth between these variables, but I just want to emphasize the importance of the social connectivity. And we were talking about this earlier this morning, but there's no doubt that social connectivity plays an important role in substance use disorder recovery, especially in environments such as sober living homes, where the social model of recovery is the mainstay of treatment. And then lastly, I wanted to leave you guys with a quote from an individual that I found was just really impactful. He said, "When I first got here, the brotherhood, like I said, and camaraderie was amazing. Everyone knew everyone. And last year when COVID hit, it seemed like it sucked the life out of the whole organization, and it sucked the life out of the whole world. And that was a scary thing." And he was just really emphasizing that it wasn't just the individual houses that were suffering, but it was actually the whole organization and the whole community of people going through recovery. And that was really powerful to me. So to conclude, we can say that the pandemic led to a significant decline in social interconnectedness and the utilization of social support services. And this led to an increase in relapse risk. We can say that treating patients in recovery throughout the pandemic and beyond will require the development of novel methods with an emphasis on social support interventions and increasing interconnectedness. And then individuals undergoing treatment for substance use disorder are a vulnerable population that deserve adequate and thoughtful interventions, not only in times of global stressors such as the pandemic, but all the time, which I'm sure we are all aware of. And I would just like to acknowledge the houses that I worked with. There was one that wanted to remain anonymous, but I'd still like to recognize them and thank them too. And that is all I have for you guys. Thank you, and I am open for questions.